Takotsubo syndrome, or broken heart syndrome, mimics heart attack symptoms. Emotional or physical stress triggers chest pain, shortness of breath, and abnormal ECG changes. This script will provide medical students with a thorough understanding of Takotsubo syndrome, including its definition, causes, symptoms, diagnosis, treatment, and long-term effects. Takotsubo syndrome is a cardiac disorder that causes sudden weakening of the left ventricular function, resembling a Takotsubo shape. Diagnosis is based on specific criteria to differentiate it from other cardiac conditions, with different management and prognosis. Takotsubo syndrome is thought to occur due to a surge of catecholamines, triggered by emotional or physical stressors. This surge leads to temporary dysfunction of the heart muscle, causing characteristic left ventricular apical ballooning. The exact mechanisms are still being studied, with potential causes including coronary artery spasm, microvascular dysfunction, and toxic effects of catecholamines on the heart cells. Takotsubo syndrome presents with chest discomfort, chest pain, dyspnea, palpitations, and syncope. ECG changes resemble acute myocardial infarction, but coronary angiography shows no significant stenosis. Differential diagnosis is important for appropriate treatment and prognosis. The diagnostic criteria for Takotsubo syndrome include the absence of obstructive coronary artery disease, ECG changes consistent with acute myocardial infarction, and evidence of left ventricular dysfunction on imaging studies, such as echocardiography or cardiac MRI. The ECG changes can include ST segment elevation, T wave inversion, or QT interval prolongation. Cardiac biomarkers, particularly troponin, are often elevated in Takotsubo syndrome, further adding to the diagnostic uncertainty. Additional tests, such as coronary angiography and cardiac catheterization, may be performed to exclude significant coronary artery disease. Echocardiography is the primary imaging modality used in the evaluation and diagnosis of Takotsubo syndrome. It allows for the assessment of left ventricular function, wall motion abnormalities, and the characteristic apical ballooning. Cardiac MRI can provide additional information, including the extent and distribution of myocardial involvement, myocardial edema, and late gadolinium enhancement. Other imaging techniques, such as nuclear imaging and coronary angiography, may be used to exclude obstructive coronary artery disease or other cardiac abnormalities that may mimic Takotsubo syndrome. The short-term prognosis of Takotsubo syndrome is generally favorable, with most patients experiencing a spontaneous recovery of left ventricular function within weeks to months. However, complications, such as heart failure, cardiogenic shock, ventricular arrhythmias, and thromboembolic events, can occur and may require specific management strategies. Long-term outcomes of Takotsubo syndrome are still under investigation, but recent studies suggest that the condition may be associated with an increased risk of cardiovascular events, including recurrent episodes of Takotsubo syndrome, myocardial infarction, and even death. In the video about Takotsubo syndrome, we will discuss the various risk factors and predisposing conditions that can contribute to its development. These include age, gender, specific comorbidities, emotional triggers, and history of psychiatric or medical disorders. Understanding these factors is crucial in managing this condition. The sympathetic nervous system plays a pivotal role in the pathophysiology of Takotsubo syndrome. Emotional or physical stressors can trigger a surge of catecholamines, particularly epinephrine and norepinephrine, resulting in excessive sympathetic stimulation. This catecholamine surge can lead to coronary artery vasoconstriction and myocardial stunning, contributing to the development of Takotsubo syndrome. The precise mechanisms by which sympathetic activation leads to the characteristic apical ballooning and left ventricular dysfunction are still under investigation. The surge of catecholamines, such as epinephrine and norepinephrine, is considered a major trigger for the development of Takotsubo syndrome. These stress hormones mediate their effects through interaction with adrenergic receptors, leading to increased myocardial contractility, heart rate, and vasoconstriction. In Takotsubo syndrome, the excessive release and prolonged action of these catecholamines can overwhelm the myocardium, resulting in temporary left ventricular dysfunction. The intricate interplay between catecholamine excess, sympathetic activation, and myocardial stunning forms the basis of the pathophysiological cascade observed in Takotsubo syndrome. Microvascular dysfunction is increasingly recognized as a contributing factor in the pathophysiology of Takotsubo syndrome. It refers to abnormalities in the small coronary arteries and arterioles that impair myocardial blood flow regulation. In Takotsubo syndrome, the catecholamine surge and sympathetic activation can induce microvascular dysfunction, resulting in impaired coronary flow reserve and myocardial perfusion. This microvascular dysfunction, in addition to direct catecholamine-mediated myocardial stunning, contributes to the development of the characteristic wall motion abnormalities and left ventricular dysfunction seen in Takotsubo syndrome. The management of Takotsubo syndrome involves supportive care, symptom relief, and prevention of complications. This includes close monitoring, pain relief, and treatment of heart failure. Medications such as beta blockers and ACE inhibitors may be prescribed, and anticoagulation therapy considered in high-risk patients. Psychological support is crucial for emotional recovery. Long-term follow-up is necessary in patients with Takotsubo syndrome to monitor complications and recurrence. Imaging tests can assess left ventricular function recovery. Patients should learn about triggers, relaxation techniques, and stress management. Medication may be considered. Recurrence rates vary. Early recognition, management, and follow-up improve outcomes. In this video, we have discussed Takotsubo syndrome in detail. It is a complex cardiac condition that has captured the interest of researchers and healthcare providers. Understanding its definition, classification, causes, disease processes, symptoms, diagnosis, treatment, and prognosis is crucial for medical students. By acquiring this knowledge, they will be better prepared to identify and treat Takotsubo syndrome, leading to enhanced patient outcomes and improved healthcare quality.